This is Jason with Retirement Insurance Specialist. Congratulations, you're ready for Medicare. Now, let's take a few steps on how you get through the entire process. First thing you need to do is you need to sign up for your Medicare card. That's that awesome red, white, and blue card. You have a 7-month window from your birthday month to sign up for Medicare. So that means you have 3 months before your birthday month, your actual birthday month, and then 3 months following. So for example, I was born in March, so I have March to sign up, the 3 months after, but I can also start February, January, December. I can actually start the whole process in December. Now, it can take up to 3 weeks, depending on how busy they are, to get your Medicare card. So I always tell people it's better to be early than to be a little bit late. Right here in the middle is how you sign up. You either call the Social Security Department or go to ssa.gov/Medicare, shoot me a message, and I'll send you this little printout for you to get started. Now, once you've got your Medicare card in the mail, what do you do? So Medicare covers 80% of your medical expenses. These red, white, and blue boxes at the top represent original Medicare. Part A, usually at zero premium, that covers your inpatient hospital services. Part B is your outpatient, and that does have a monthly premium. For 2026, it's $202.90. Now that again only covers 80%. So then you have two options. You go to original Medicare, or you can go from original Medicare to Medicare Advantage, or you can go to staying on original Medicare and get a supplement policy. So I'm going to talk about both of these. First, Medicare supplement. So if you go to the left side of the page here, that covers your remaining 20%. So you essentially have Part A and Part B will be billed first through the provider. And then your secondary, your Medigap or Medicare supplement policy kicks in to cover the remaining 20%. That does mean that there's a monthly premium for that, and that does rise year over year. Now, this side of the policy is also very a la carte. So you actually have a couple working components. So again, you have your red, white, and blue card first. You have your secondary, your Medigap to jump in for your remaining 20%. And then you have prescription drugs, Part D, vision and dental. Now, all of these can be with a different company. So let's kind of talk through them. Now, prescription D, Part D, also called PDPs, that is for your prescription meds, and that can be a separate company from your Medigap. Most of the time, we're getting our clients $0 to $2.50 for their monthly premium as of 2026. Now, the only time to change that after your initial enrollment period is your annual enrollment period. So now your initial enrollment period is when you're turning 65, first eligible for Medicare, or if you're already 65 and you've been working and you're now leaving the workforce and going on Medicare, that's your initial enrollment period. AEP happens through October through December every year, and that's when we can adjust or change plans after your first sign up. So you can pick a prescription drug plan and then vision and dental. Okay, vision and dental again could be from a third company, someone totally different. Now, the Medigap policy will cover 20%. So as a recap, original Medicare kicks in, they get the bill, they send the remaining bill to your Medigap policy. They then will pay the remaining 20%. You have your prescription drug plan, vision and dental. Now, how is that different than Medicare Advantage? Well, Medicare Advantage does not use original Medicare. You're foregoing this part up here, except for this. Everybody has to pay that premium of $202.90. So a Medicare Advantage now takes 100% of the responsibilities, and they kind of like when you were working with an employer, you had a PPO or an HMO. The Medicare Advantage is an all-inclusive. So the prescription drugs is part of it. The vision and dental is part of it. This is all together, whereas original Medicare is pieced through. Those are two big differences between the two plans, but there's more. So let's go to the next page. Now, again, the left side of the paper, I'm going to go back up here, is original Medicare. The right side is Medicare Advantage. Okay, so the right side is Medicare Advantage. So now going back to our Medicare supplement. Now, the Medicare supplement is a nationwide network. It's regulated by the federal government and the state government, and all providers in the supplement policy must follow the same rules, have the same payouts, have the same doctors. So the name of the company is not as important. Again, remember, going back up here, you're going through original Medicare when you stay on this left side with the Medicare supplement. So this is when you hear things like plans G, plan N. Okay. So again, to recap, nationwide coverage. So if your doctor takes Medicare, they take Medicare supplement. Doesn't matter if it's some of the big names or, as we joke in our office, Taco Bell insurance. They all have to cover the same thing. So what are you looking for when you're looking for a plan on this side? You're looking for customer service rankings, experience that we've had in the industry dealing with them, paying their claims, customer complaints or reviews, and then your premium. So the name of the company is not as big of a deal on the left-hand side because everybody pays the same. Now you do have a deductible on this side. Now remember, going back up, everybody, no matter what side we do, pays the $202.90. Original Medicare then has a deductible of $283. Then you are done if you're on Plan G. There are some other plans that we can discuss based on needs. Now, how is this difference? Well, the Medicare Advantage side is a closed network, whereas you see over here, we have a nationwide network for supplement, closed network for Advantage. You're talking PPOs or HMOs, and we're finding more and more HMO networks, especially in Maricopa County. Now, one of the negatives is that providers can enter and leave the network. So if your doctor is with your current company, they can decide to no longer work with that company, or the company can decide no longer to work with the Medicare, that provider, that Advantage plan. So you do have the chance of doctors leaving the network. You also may need referrals. Okay, out of state, you are in a closed network. So PPOs or HMOs, you'll either have higher numbers if you're in the PPO, or you won't be covered if you're in the HMO network. Okay, this is where the name of the company is a little bit more important because we want financial stability. We want large doctor networks because it's a PPO or HMO. Now, you do have a deductible here. Now, there is no monthly cost for most of these plans, whereas on this side, we have a premium. We pay per month, okay, monthly premium. Okay, most Advantage plans have a 0 per month premium, but they have larger deductibles. The HMOs, $2,800, $3,500, somewhere in that ballpark. Whereas the PPOs are going to lots of times have deductibles over $6,000. Okay, now those are the two big differences. So again, nationwide versus closed. Okay, you have a premium over here where no premium. You have a very small deductible and a large deductible. Okay, now on some of the other differences, the Medicare supplement side, you can shop your plans anytime except you are subject to underwriting. So when you sign up, the first time you sign up for Medicare, it's very important to understand this chart and which side is better for you, because if you want to get onto the Medicare supplement side, when you first turn 65 or when you are first leaving the workforce, if you work past 65, that is the only time you're called guaranteed issue, whereas you can get into any plan you want, regardless of health history, and they do take you. Now, 2, 3, 4, 5 years down the road, if you want to change, you are subject to underwriting. So if something has come up, anything with the heart, diabetes, cancer scares, any of those big red flags, a company doesn't actually have to underwrite you and take you. So you're stuck where you're at. Now, the differences over here is there is no underwriting. They take you. Okay, again, 0 cost premium, but it's a closed network. So we can change you anytime on the Medicare Advantage, okay, for a no cost. So now when do we shop those? Well, after you're enrolled, we can shop our supplement policy, again, subject to underwriting, any time of year. We actually recommend doing it Q2, Q3. We want to do it in the summer, the slow times, because you get faster results and we don't get bogged down. On the Advantage side, the only time to shop is actually during AEP, which is October through December. And then we have this little chart here to kind of explain the differences. Both pay Part B. This is a pay per month. You have a premium. This is a pay as you go, a 0 premium. Very small deductible for 2026. We're at $283 versus large deductibles. A large nationwide network versus a closed network PPO or HMOs. Usually you don't need referrals on Medicare. Sometimes you need referrals depending on the company. This is government controlled, whereas this is private company controlled. You can quote unquote shop your policy anytime. Of course, you're subject to underwriting, and you can shop this policy only during AEP. Okay. Now, that's very important to kind of understand the differences. So when you're looking through your options, make sure you know the differences between Advantage and supplement policy. What we do here is a free, no obligation consultation with our members. We actually, full transparency, we get paid through the provider that you choose, and they all pay us about the same. So we're not biased. We don't push you towards one company or the next. We really look at your different needs. We do an analysis with you based on healthcare, lifestyle, do you travel, family history, and we kind of help guide you and educate you on which side is better, the supplement or the Advantage side. And then we work through and help to say, do we need to piece some things together if we're on the supplement side, or what are all your options if you're on the Advantage side? So that's the big difference between Part A and Part B going into Medicare Supplement or Medicare Advantage. And for any other questions, please let us know. My name again is Jason with Retirement Insurance Specialist, and we're here to help you.